Hi everybody, welcome back to my channel. Let's talk about sleep. So we're going to talk about sleep. What I want to cover today is CPAP, everybody's least favorite, I guess, treatment for obstructive sleep apnea. So what is it? Well, CPAP, what it stands for is continuous positive airway pressure. And that last P is very important. All CPAP is doing is it's blowing a continuous stream of pressurized air into a interface, which we'll talk about in a second, which then allows the air to travel down towards the back of the throat and force the airway open. So it's kind of like an airway splint. If you remember from our conversation about obstructive sleep apnea, what's happening is this is your airway when you're awake. When you fall asleep, the muscles, again, back here relax and the airway becomes a little bit smaller. When somebody snores, what's happening is the airway becomes even smaller than that, and the air space becomes very, very tiny, and as a result, when the person breathes in and out, the tissues vibrate. That's snoring. And then the next step down would be the airway totally closes off. That's apnea, okay? And as we said before in the previous video, when that occurs, the airway closes off, the brain doesn't let you die. It says wake up or move around or do something. So what CPAP is doing, in essence, is preventing that from happening by blowing pressurized air in and forcing the airway to remain open. So by doing so, you're going to eliminate the snoring, but more importantly, eliminate these apnea events. So it's CPAP, continuous positive airway pressure. And like I said, it's just pressurized air. This is not oxygen. This is not a ventilator like you're in the hospital, like in the ICU. It's really just air. Okay, just as an aside, I find some people call it CPAC. I think that's because of a Z-Pack, but you know, that's neither here nor there. The P, the last P, PAP, is very important. Okay, so what happens nowadays is, let's say somebody comes in for an evaluation, whether it be a home test or an in-lab test, which we'll go over at some point in another video. And the insurance company sees, okay, this person has legitimate obstructive sleep apnea, they will then allow us as a physician or clinician to prescribe the CPAP for the person to get at home. That prescription goes to what's known as a home care supplier or a DME. It's called a durable medical equipment supplier. They process it through insurance. It can take, a couple weeks or so. And then once that's done, then they'll contact the patient to come deliver it to them. That's the way we do it at our place anyway. Then once the person gets it at home, usually what happens is they'll get a device. It's kind of like the size of a clock radio, give or take. There's usually the unit itself, and then maybe a small thing on the side that has a space for water to go. So you put distilled water in there. And what that is, it acts like a humidification chamber. So the person is allowed to breathe in warm, humidified air as opposed to cold, dry air, which can make it more palatable, which is a pun in this case. And it's been shown to improve compliance. So this whole unit sits on the nightstand, plugs into the wall. Then there's a 6-foot-long tube, which is attached to a mask. Now, the mask can either range from what's known as nasal pillows, which are 2 little prongs that sit in the nostrils, to a nasal mask, which goes over the nose, to a full face mask, which goes over the nose and the mouth. And that's kind of the ones that people always attribute to, let's say Darth Vader masks or whatever else. How it gets into the airway is based on whether the person is a mouth breather or whatnot, and we can talk about that at some other time. But essentially, the principle is all the same, is that this machine is generating pressurized air. The pressurized air comes into the air passages, and it forces the airway open. Now, what I tell my patients, and this is the truth, CPAP really is probably one of the best treatments we have in the entire field of medicine. And I'm not saying that just because I do it. What is it? It's just air. This is not oxygen. Nothing. It's just pressurized air, and it can add 10 years to people's lives in some cases and help them to feel better. There's no side effects. The question I always get is, will this work for me? And the answer I always give is yes. That's the short answer. CPAP will work. For obstructive sleep apnea, CPAP in one form or another will force the airway open and alleviate the problem. The question is not will it work. The question is, can the person tolerate it? Will they, will they take to it? Will they get the benefit from it? Will they feel like this is helping me and therefore continue to use it? Because something that's, quote, effective but sitting in the closet collecting dust is not going to help them. So yes, CPAP will work in obstructive sleep apnea, but we got, as my job and the patient's job together, is to find something that'll make it work for them. And fortunately, there's about probably 50 different masks out there, different styles. And then there are 3 main CPAP companies: Philips Respironics, ResMed, and Fisher and Paykel. And they all have very similar algorithms as far as how they do this. One thing I should mention is we're talking about continuous positive airway pressure, so CPAP. I'm going to get out on the soapbox for a second. We live in a world nowadays where insurance companies tell doctors what to do, unfortunately, not the other way around. So what happens sometimes is we are at the behest of what a patient's insurance company will pay for. That leads us to do home tests and things of that nature. When it comes to CPAP, the ideal situation would be somebody comes in for an overnight sleep test to diagnose a sleep apnea. Then they come in for a second night to figure out what CPAP setting they need, what mask is going to work best for them, and so on and so forth, because there's different ranges for the CPAP setting. Sadly, we're not allowed to do that in many cases, so we have to prescribe what's known as an auto-adjusting or an auto-titrating machine, otherwise known as APAP. Same principle, but what this machine does is it's kind of like a smart machine in that if the person's airway is closing off, the pressure will ramp up to a setting that we set based on what we think will work for the patient. Principle is the same, though. So the person gets the machine, they start using it, and going back to the insurance situation, what happens is the person needs to be in compliance. Now, what does being compliant mean in this situation? That means using the machine for 4 hours a night, 70% of nights over the course of a month, 1 to 3 months. That translates to 5 nights out of a week. Now, what I always tell my patients is I don't give a damn what the insurance company says. I want you to use this, especially if it's a severe case, every single night, right, as much as you can, because that's really where the benefit comes from. The 4 hours, 70% of the night, that's kind of an arbitrary number, but that's what Medicare uses, and that's kind of the basis for other insurance companies. But what's really cool is that the machines nowadays, they actually have this capability of monitoring how the patient is doing at home. So let's say somebody comes in and they have an apnea index that we discover of 20 per hour. What that means is 20 times per hour their breathing is stopping. Sounds like a lot. That's actually moderate sleep apnea. So the goal with the CPAP machine or the APAP machine would be to get that number, that apnea number, to be below 5. That's normal. So what's cool is these machines nowadays record all that information. So I can see Mr. Jones uses the machine 7 hours a night, and their apnea index has dropped down to 1 per hour. That's great. And if they also feel good, then that's even better. What I always tell people, though, is that if you feel better, that's great. That's awesome. Makes my job easier. But even if not, this is doing good for your heart health, for your blood sugar health, for everything kind of going on that sleep apnea can be associated with. This is going to help, certainly long term. So, so that's kind of the ins and outs of CPAP and how the process goes along and what we're doing with it and why it's working. Like I said, unfortunately, is that people have sometimes bad associations with it, because CPAP has been around since 1982. So people have seen those big masks and the big machines and all that. Fortunately, like all technology, it's getting smaller and smaller and smaller. Eventually down the road, we're probably going to get these, instead of a machine and tube and all that, we're probably going to get little self-contained units that just kind of pop on the nose or on the nose and the mouth, and that takes care of the whole thing. So until that happens, we're left with what we have. But like I said, I believe in CPAP very, very strongly, and those who really stick to it and use it, they will feel the benefit, and in most cases, and certainly their insides will feel the benefit. So that's what we'll talk about. That's the end of this today. If you have questions, please leave them in the comment section. I will try to get all of them answered. If you like this video, please click like. If you like the channel, please click subscribe. My book, Let's Talk About Sleep, is on Amazon. Published by Rowman and Littlefield, came out in 2018. Daniel A. Barone and Lawrence A. Armour are the authors. So if you're so inclined, please pick that up. And thank you for watching the channel. I will see you guys in the next one.